COVID-19, as we all know, has not hit everybody equally, and that's prompted efforts to bridge gaps and improve access to vaccines, testing, and such. Now, Omicron has raised the stakes even more. With us for more, from the provincial capital, we welcome Dr. Andrew Boozary, Director of Social Medicine and Population Health at the University Health Network. And I've seen you on so many other channels, I can't believe we haven't had you on before. So welcome for the first time to the agenda, Dr. Boozary. How you doing?
I appreciate it. Thanks so much for having me. And I think this has been much longer than anyone hoped, but appreciate having the chance to have the conversation.
Not at all. Let's start here. How has access to COVID-19 testing in particular been, in your judgment, inequitable so far as Ontario's Omicron wave is concerned?
Yeah, I think one of the things, Steve, that has been really clear, throughout every wave, through each wave, is that there has been real barriers for people trying to access healthcare and supports and help. And this is one of the things that we've seen play out early on with PCR testing. We've seen it play out with access to the vaccine. And now we're really seeing it again with access to rapid antigen testing. And it's been, such a challenge and been such a burden for people to try to get access to testing that we've seen, throughout the country, chief medical officers of health describing it as really a privilege or a luxury. And this is one of the things that has been, again, speaking to this tale of two pandemics of power and privilege, of profit and people. And when we're seeing these divides in terms of who has the luxuries and privileges in a pandemic, this is where we're seeing, again, this widening in the health outcomes and the health access that we know is so crucial in a pandemic.
Now that's testing. Let me ask you about vaccination, because overwhelmingly the story we hear these days is if you haven't been vaccinated, it's because you're trying to make a political statement or you're nervous or hesitant or something. The story about people not being vaccinated because they might have a social or economic barrier to doing so, does that exist in any kind of significant numbers?
Yes, I think it's still very real for people. I mean, I think this is one of the challenges when you try to have a reductionist view or try to put one moniker or one tag on, different people's realities and different people's lives. And I think when we have to be honest again about speaking to the real setbacks and barriers that we have in our universal healthcare system, which is not so universal for everyone, which I think is one of the very clear learning points, I hope, throughout this pandemic, is that people have very different experiences, have very different histories with the healthcare system. There's different levels of trust. There's also, again, real barriers in terms of people's fears, in terms of being able to continue to work or take time from work. And again, I think when we're looking at some of the data, it continues to be, marginalized communities who rightfully have mistrust with the healthcare system that has not put their interests first. And people are now having to navigate these really hard decisions about wanting to put their loved ones and themselves first. With changing science, changing data, a lot of complexity. And so again, I think we have to have a little bit more nuance, a lot more understanding and compassion as to why certain people aren't coming forward. Of course, all of us are tired. All of us want to see people step up to be able to do the right thing. And we've seen the dramatic impact of vaccines and being able to keep people out of hospital, out of the ICU. And we know this has real impacts on other people who need other services and other procedures. So there really has to be an element of how we're pulling together and being able to ensure that people are able to get the questions they need answered.
But when they see numbers such as nearly 90% of people in the province of Ontario have been double vaxxed, why do you think, the government may be powerful, but they can't brainwash 90% of the people, presumably. So why does that not ultimately change the decision that those who, for not political, but for other reasons, won't get vaccinated? Why isn't that having an adequate influence in your judgment at the moment?
Well, I think it's a really important point that you raise. I think we can, continue to look at areas where we need to see improvement and be able to have better outreach and be able to have different ways in communicating and being able to have, as mentioned, people have their questions answered. And we've seen that it's not always a healthcare provider. It can be community ambassadors, community leaders, faith leaders, and we've seen incredible leadership, as you've mentioned, to get to 90% of the population that's double vaxxed. So that's an incredible story in terms of what efforts have happened on the ground to get us to where we're at right now. I think the challenge, what we're seeing with Omicron, especially about how transmissible it is it's really putting people who are unvaccinated at risk. There's higher numbers of people who are unvaccinated in the hospital and ICU. And when we're looking at staff shortages and the real stressors on the healthcare system, it has an impact on everyone. So I think, to your question about how do we ensure that more people are stepping up to get vaccinated, I think, other policy measures have worked. There'll continue to be people who have, the reticence to do so. But, just for me personally, in the last week, there are a few people that I've known for many years that have stepped up to get their first vaccine. So there's still the opportunity here for people to not only change their minds, but be able to be better informed and also better understand what stressors are on the system and the part that they play in ensuring that we get through this. And I think that's becoming more evident for some folks. And again, some folks are just never going to want to be vaccinated. And those are different decisions, and those are different policy calculations.
Just out of curiosity, the people who, for whatever reason, managed not to get vaccinated for the last 13 months, but who just did, those people that do you know why they ultimately decided this many months into this pandemic to finally come forward and take it?
Well, I think for some of them, they're seeing that it's more real. They're able to know more family members or friends who are being infected. I think that they've had fears about the vaccine, some of them, wanting to be able to speak to, a healthcare provider or someone else to be able to get their questions answered, be able to do, some of their own due diligence, but be able to have, the opportunity to have that conversation. I think one part that we've not fully embraced is that, not everyone has access and the privileges the way that, it may be reported. There are people so many, I think maybe 10% is the latest number. It might be higher. Again, it's hard to tell with the pandemic as there's a lot of change in our health services data. But people are without family doctors or without nurse practitioners, do not have the continuity of care that they want with a healthcare provider to be able to have that trust, to have some of these conversations. So these are crucial conversations. These are questions that people are making about their own lives. Again, it's about a collective responsibility, but not everyone is as plugged into the system or has the trust with the system or has healthcare supports and social supports around them to be able to have these conversations at a time when would have been ideal. But there's still hope in the sense that people are stepping up to do this. There's obviously a lot of division out there and a lot of vitriol that makes some of these conversations really hard. But that's where I think, for many of us who've been doing some of this work on the front line, it's to continue to have no judgment, be able to be open and get the information, the vaccine out to where people are at.
No, I appreciate that. And again, I want to take politics out of this conversation and just and really focus on the reasons that some people might not be vaccinated that don't have to do with politics. And I wonder now, for example, if the Minister of Health were here, she would say, we've taken every possible step to make access to vaccination as broad as possible, pop-up clinics and in hospitals and, at hockey arenas and everything. And I just want to be sure I'm clear. In spite of all that, do you think the government has taken adequate steps to ensure access to vaccination for some of the groups that you've identified who might typically be either suspicious of the healthcare system or not have a family doc to rely on?
Yeah, there's no question, Steve, that there's been really important outreach. There's been investments. There's been community leadership to get the vaccine out to where people are at. So the initiatives that you mentioned, many of us have been involved with in terms of the pop-up clinics, some of the mobile solutions. These are efforts that have saved lives. There's no question in terms of, especially around the innovations that have come from community. And I think when you go back, full circle in the discussion about testing, this is where initially testing came out really either available at hospitals or pharmacies with the COVID assessment centers. But we saw incredible community leadership to say, well, these are the barriers that people, may not have paid sick leave, may not be able to go out to a hospital, may not trust their experience within a hospital or other healthcare setting. And we saw the testing go out to parking lots, to places of worship, to be able to have community ambassadors that have been the real drivers of being able to get that information and that access out. I think one of the elements that we also have to have humility about is with respect to this has been over the course of the past year, and as you mentioned, or 13 months. And that can seem like a really long time that people have opportunities or ample opportunity to go and get vaccinated. But when we're talking about mistrust with a system, this spans decades for certain communities, for certain populations. And so just the fact that we're starting to see, some people, because of these efforts, because of community leadership, step up to get vaccinated, see different approaches with how they're going to take care of one another with the vaccine or with other public health measures of masking and other efforts that, again, before the pandemic was not really on the radar. That is really significant, but we're not going to erase the mistrust of decades within 13 months. And that's part of the humility that we need in terms of being able to understand that there's going to have to continue to be more work, continue to be more effort. And we have to meet people where they're at with the same commitments. I mean, we're asking people who've been marginalized and shut out of the system, who have not been cared for, who have not been a priority, to say, well, you now are a priority as a government or a policymaker. But some feel that they may step up, get vaccinated, but then what happens? Where's the supports? Where's the trust? And what happens now when people may feel like they're left on their own? So this is part of that journey, and I think it's many of us want to be seeing this 13 months. It's a long period. We've all been through this for such an incredible long period of time, but it's something that we have to take within the context of the decades, if not centuries, of mistrust that is in our society and is within healthcare itself.
I should ask you about, I guess, what is the most controversial idea out there right now, and that is, if we believe that it's the best thing for society for as many people as possible to get vaccinated, should we fine those who won't?
Yeah, I don't think that this is the right approach and one that we need to be doing right now, especially when, again, there are still people who are stepping up to get vaccinated with other measures and efforts. I mean, I think there hasn't been a lot of clarity also about this discussion about fines. I mean, we've not seen anything by the way of substantive public policy on this. The issue that many of us may have with respect to fines, and one that I do, is that if it's tied to healthcare access or healthcare utilization, I find that very troubling. I think it really undermines the principles of the Canada Health Act. It undermines this very thing that we've been talking about, making the healthcare system more universal, more inclusive. And when we think about things like a fine for people who may not be vaccinated now, it's a very regressive policy, especially for the challenges that people have already have. And when we look at some of the data, again, around the socioeconomic gradient, the socioeconomic impact that COVID is having, the disproportionate impact the policies are having in terms of the response. To add a fine only, I think, further it is punitive. I don't think it speaks to the values that we have in terms of ensuring that our system is universal, that it continues to allow people to make the decisions they want, but that our healthcare system needs to be there. I think it also opens up a whole host of real issues and things that are very problematic if we start saying we're going to levy fines based on people's healthcare utilization. And that's not a path I think that we can or should go down as a country. I do think we need to continue to fight for putting the best information that's possible out there, to be able to have other measures and other ways to ensure that people are having more opportunities to get vaccinated, and also to keep safe. I think this is one of the elements where, again, there's so much frustration, there's so much exhaustion in the healthcare system, but we have to be really mindful of what our policies can do, who our policies impact, and the context and the historical context of who's already been most punished through this pandemic before, there's this view of sort of populist fines. Well, I think we all want to see people who've, not been able to contribute the vaccine or putting other people at risk to step up. But this is really something where we need to be thoughtful before running into these kind of measures that can really undermine the entire premise of our healthcare system as it currently stands.
I'm afraid I'm down to my last 20 seconds here, but I do want to ask you about what the most important thing you've learned over the past couple of years has been in terms of getting appropriate pandemic response healthcare to those groups that normally can't access it as easily as others.
We have to put health equity, and by that meaning removing the fundamental unfairness, right at the center. We have to be having this part of every policy and every way we deliver care to ensure that it gets to people who need it most. The fact that we've had a recent rollout and that we've not seen the learnings to say, well, it's open to everyone 18 plus, that is a mirage of universality. That is a mirage of fairness. And so we can best understand that there are people who continue to have these systemic barriers that are continuously punished by the structural determinants of health. We need to ensure that this is the focus, that this is the real deliberations, and implementation is key in these policies, that really puts people who've been marginalized first and at the center. If we do not do this, we will continue to see not only the health gaps that we've seen pre-pandemic, but what worries many of us is actually a widening in the health disparities. And that's something that we just cannot afford right now, given all of the hurt and this pandemic of suffering that people have been through.
Dr. Andrew Boozary, University Health Network, thanks for coming on to TVO tonight and sharing your views. We're really grateful.
Really appreciate it. Thank you so much, Steve.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.